Safe anesthesia practice is the best medical treatment that a patient can receive by the most highly educated person. And in this case, it would be the physician anesthesiologist that's providing anesthesia care to the patient, whether as the sole anesthesiologist or as the leader of an anesthesia care team. So there are a group of people who can take care of a patient during the course of an operation. There's the physician anesthesiologist who oversees the care of the patient, and that would involve all the medical issues involving the patient, evaluating them ahead of time, making sure that the patient is really safe to undergo the procedure. Then the patient comes into the operating room, and it's an anesthesia care team that's involved with the patient. If there is an anesthesia care team, then it would be the nurse anesthetist that's working alongside in coordination and under the direction of the anesthesia attending to make sure that the patient is safe. The component which I already referred to of the nurse anesthetist is a person who is trained specifically in anesthesia. After they go through an undergraduate training process, they do some specialty time in anesthesia, and they're there to really help the anesthesiologist take care of the patient. The physician anesthesiologist who is involved with the patient has a broad knowledge of the patient based on the fact that they went to medical school after an undergraduate degree and then did a residency for 4 years after medical school, and some people have done some subsequent training in addition to that. And that really comprises your anesthesia care team. You know that the Institute of Medicine has noted that anesthesia as a group has provided significant patient safety for their patient population, and we really want to maintain this. And in New York State, we have a policy where the anesthesiologist, as the physician anesthesiologist, is supervising the nurse anesthetist. And I think New York State could be proud of the record that it's had on patient safety and continue with this safe anesthesia practice. The concept of when second counts means to me that when a patient is in an emergency situation, who is there to respond? So let's look at this in the context of most other physicians who practice. In an internal medicine office practice, and these people are very highly trained, they may be treating a patient with an antihypertensive or an antibiotic and say, listen, take this medication, come back in a week or 2 or 3 weeks, and we'll see how you're doing it. In the operating room, where there may be significant swings in blood pressure, there may be significant changes in the blood volume in a patient and changes in heart rate, you have to respond in seconds. If the patient has a very, very significant decrease in their blood pressure, some problems with breathing, if you're not in there to take control of the airway, if you're not there to administer medications quickly, the patient can really have a very, very adverse outcome, and the patient can even die. That's what second counts means to me. Who's there to respond immediately should an issue arise, and more importantly, who is there to respond, who is educated enough to respond in the right manner so that the patient survives.